5 health checkups you should avoid. After 70, that may harm you more than help. Picture this. You're in your 70s, and you've lived a full life, enjoying every moment. You've probably had your fair share of doctor's visits, health checkups, and maybe even some routine tests. But here's something that may surprise you. Not all of those checkups are as beneficial as you might think. In fact, some of the most common screenings for older adults could actually be doing more harm than good. Sounds strange, right? After all, doctors recommend these tests to keep us healthy, don't they? Well, here's the shocking truth. Some of these tests, especially after 70, are often unnecessary, and the risks they carry might outweigh any benefits. Stick around, because we're about to dive into the 5 health checkups you should seriously reconsider after the age of 70, and why they could be putting your health at risk. 1. Routine mammograms for women over 70. Let's start with one of the most commonly discussed health checkups for women, mammograms. We've all heard that regular mammograms are essential for breast cancer screening, right? But did you know that for women over 70, these routine screenings may no longer be as crucial as you've been led to believe? In fact, recent guidelines from major health organizations, including the American Cancer Society, suggest that women over 70, especially those with no personal history of breast cancer, may not need to undergo mammograms every year. Why? The risks associated with false positives and overdiagnosis are much higher in older women. A false positive can result in unnecessary follow-up procedures like biopsies, which can be painful, invasive, and anxiety-inducing. And that's not all. These false positives often lead to treatments like chemotherapy or radiation, which carry serious side effects. The truth is, breast cancer in older women tends to grow more slowly and may not pose an immediate threat. In fact, a study published in the BMJ found that over 10,000 women aged 70 and older are treated unnecessarily for breast cancer each year due to false positives from routine mammograms. So before scheduling that next mammogram, ask yourself, is this really benefiting you, or is it just adding unnecessary stress and risk to your life? 2. Prostate-specific antigen, PSA, test for men over 70. Now, let's turn our attention to men. If you're over 70, you've probably been encouraged to get a PSA test to screen for prostate cancer. This simple blood test measures the level of prostate-specific antigen, a protein produced by the prostate. Elevated PSA levels can suggest the presence of prostate cancer, but here's where it gets tricky. High PSA levels don't always mean cancer is present. In fact, many prostate cancers are slow-growing and will never cause any harm, especially in older men. The real issue arises when men with elevated PSA levels undergo invasive procedures like biopsies, or even treatments such as surgery or radiation. These interventions can lead to significant complications, including incontinence, erectile dysfunction, and bowel problems. And here's the kicker. These treatments may not even be necessary because the cancer was likely so slow-growing that it would have never affected your life. The U.S. Preventive Services Task Force recommends against routine PSA testing for men over 70, specifically because the potential harms, like unnecessary treatments and anxiety, often outweigh any benefit. So before you jump on the PSA test bandwagon, consider whether this test is really serving you, or just leading you down a medical path that may be best avoided. 3rd Annual EKG, electrocardiogram, screenings for seniors. Let's talk about EKGs, those tests that measure the electrical activity of your heart. You might be thinking that an annual EKG is essential, especially as you get older, right? After all, heart disease is a leading cause of death in seniors. But here's the thing, routine. EKGs for older adults without symptoms or a known history of heart disease aren't really providing the benefits you might expect. The Archives of Internal Medicine conducted a study that found annual EKG screenings for seniors don't actually reduce the risk of heart attacks or improve long-term survival rates. In fact, many EKGs reveal minor irregularities in heart rhythm that are harmless and don't require intervention. But these false alarms can lead to unnecessary follow-up tests, medications, and treatments, which can be costly, time-consuming, and even harmful. Imagine getting an EKG only to find out it detected something that's perfectly normal for your age, like atrial fibrillation, which is usually not life-threatening and doesn't need any drastic treatment. The best advice? If you're feeling fine and don't have any symptoms of heart disease, an annual EKG may not be the miracle test it's made out to be. Instead, focus on maintaining a heart-healthy lifestyle through diet, exercise, and regular check-ins with your doctor if you experience any symptoms. 4. Vitamin D screening for older adults. Vitamin D is a vital nutrient that helps your body absorb calcium and maintain strong bones. But does it need to be checked through regular screenings? Not necessarily. While vitamin D deficiency is common in older adults, routine screenings for the vitamin, especially in seniors without symptoms, aren't recommended by most health experts. In fact, the U.S. Preventive Services Task Force has said there isn't enough evidence to support widespread vitamin D screening for the general population. Why? Because many older adults already get sufficient vitamin D through their diet, sunlight exposure, and supplements. Overscreening for vitamin D levels can lead to unnecessary treatments, like high-dose vitamin D supplements, which can actually be harmful if taken in excessive amounts. Too much vitamin D can lead to calcium buildup in your blood, kidney problems, and other serious health issues. So rather than stressing over regular blood tests, focus on getting a balanced diet rich in vitamin D, spending a little time outside, and taking the appropriate supplements if your doctor recommends them. 5th Annual Full Body Skin Checkups. Lastly, let's tackle those annual full-body skin checkups that many seniors schedule, often out of concern for skin cancer. While skin cancer is indeed a serious condition, the necessity of yearly full-body exams for everyone over 70 is actually questionable. The American Academy of Dermatology doesn't recommend routine full-body skin exams for everyone, especially if you don't have a history of skin cancer or any suspicious spots on your skin. The reality is, most skin cancers develop slowly, and many cases can be spotted with regular self-examinations. Full-body checkups, while well-intentioned, often lead to unnecessary biopsies for minor issues, which could result in scarring or unnecessary treatments. And the emotional toll of being told you have a suspicious mole or growth can be significant, especially if it turns out to be harmless. The better approach? Become familiar with your skin. Check yourself regularly for any changes, and only seek a dermatologist's advice if you notice something that doesn't seem right. This way, you can take a proactive approach to your skin health without the stress and inconvenience of annual checkups that may not be needed. The key takeaway? It's essential to stay informed, question the need for certain screenings, and focus on maintaining a healthy lifestyle through diet, exercise, and preventive care. After all, your health is your greatest asset, and it's important to make decisions that genuinely serve your well-being. If you found this video helpful, don't forget to give it a thumbs up, share it with someone who might need to hear this, and hit that subscribe button for more valuable health tips. Thanks for watching, and take care of yourself.